Well, welcome back. Months ago, the idea of having to get a third vaccination was far from reality. Well, as of Friday, it's what a certain group of Americans are now being advised to do. 2 on your side's Liz Lewin has more on what the CDC is doing to help protect people with weakened immune systems.
This group of immunocompromised individuals never had a good response in the first place.
The CDC is placing a new focus on immunocompromised people who received both doses of Pfizer or Moderna vaccines and are now recommending a third dose to boost protection.
I think the reason this approval came at this time is the FDA and the CDC wanted to have confidence that that third shot would be safe.
Experts say there's currently not enough data to support a second vaccine for immunocompromised people who received the J&J vaccine. But Dr. Thomas Russo, an infectious disease expert at the University of Buffalo, says the contagiousness of the Delta variant is a serious concern for roughly 7 million American adults with weakened immune systems.
That's why the CDC and the FDA have acted at this time to try to improve the degree of protection with that particularly vulnerable patient group to hopefully prevent infections, keep them out of hospitals, and minimize bad outcomes.
Dr. Russo says this third vaccine could be extremely helpful when it comes to breakthrough infections.
By giving them a third shot, hopefully they'll receive the same level of protection as non-immunocompromised individuals that had a great response when they received the 2 shots.
So, who qualifies? The CDC tweeted this out. If you've had an organ and/or stem cell transplant, are living with advanced or untreated HIV infections, are undergoing cancer treatments, or are currently taking immunosuppressant medications, you qualify.
If your physician feels that you qualify for this immunocompromised group, go ahead and just receive that third shot.
Claudine, I'll point out a couple other things. The CDC and FDA aren't currently requiring people to check their antibody levels, so a doctor's note won't be needed to get a third dose. If you do qualify and have been fully vaccinated, you must wait at least 28 days after your second dose before you consider getting the third one. In the newsroom, Liz Lewin, Channel